Good evening. I'm thankful to have a few moments to come back to you after a long day in the office here in Ocala, Florida, for the threefold purpose of thanking you for all of your prayers and your notes, your donations to Give, Send, Go, and just incredible support from around the country and the world. Secondly, to lay out what's been going on with regards to my ability to practice family medicine. And thirdly, maybe to come up with a course of action in light of what's going to take place next Tuesday, June 27th in Lexington, Kentucky. Firstly, again, I'm overwhelmed by the almost 7,000 folks who've contributed their prayers and their support on Give, Send, Go. It's been overwhelming, and I want each and every one of you to know that the funds that were raised there have not been utilized at this moment. They are being prepared to be utilized, or I'm preparing to have to use them for a legal battle, and not just my legal battle, but also the legal battles of other physicians, such as Dr. Casey Del Coco in Indianapolis, another family physician who's been threatened with decertification, and the many medical students, even pre-med students who I meet and who are just overwhelmed by the prospect of having to get into the healthcare system at a time when contrary viewpoints with which are conflicting with the ongoing narrative, are not welcome in medical schools and beyond that level of training in residency and even in employment situations. So again, thank you. This is a very unique time in the history of medicine in America, where physicians are being singled out and silenced and retaliated against for choosing to question a line of treatment, or in the case of the COVID vaccine, preventive measures, which, as many of you or all of you, I think, agree, have not been the optimal approach to the prevention and treatment of coronavirus. And so what has happened here in the last several months with the American Board of Family Medicine specifically is that we have, thanks to the efforts of Jeff Childress up in Gainesville, we filed an appeal to them. We've actually sent a couple of letters to them over the last year and a half. And then finally they said that on June 27th in Lexington, Kentucky, they will be meeting, and they, being the professionalism committee of the American Board of Family Medicine, will be meeting to determine whether or not myself and Dr. Casey Del Coco in Indianapolis are worthy of being considered board certified in family medicine. And, you know, that's after 34 years of continuous board certification to this point for myself, or going on 34 years. Dr. Casey Del Coco actually was one of the residents who mentored under me when she was still in her residency in family medicine, and has been a very heroic young woman who spoke out before the Indiana State Legislature about the potential harms of the COVID vaccines, and for that she has been considered unprofessional and unworthy of being a family physician in this country. So what actions can we take in this country? Well, I want to tell you what's happening right now, and what perhaps some of you might consider doing if you have time, energy, and the inclination to do so. First of all, I have assembled a legal team to consider taking on the American Board of Family Medicine. There's many aspects to that, and the two primary litigating attorneys with whom I'm working are Matt Staver of the Liberty Counsel and Andrew Schlafly, who is the Chief Counsel for the American Academy of Physicians and Surgeons. However, we're somewhat in a holding pattern until we see the outcome of the appeal on June 27th. Regardless of the outcome, there needs to be action taken to address this vindictive, tyrannical behavior, not just of the American Board of Family Medicine, but all the specialty boards in this country, all the licensing agencies, and other bodies which have been attacking those of us in the medical freedom movement who dared to speak out on behalf of our patients who were denied life-saving remedies in the hospitals, in the outpatient setting, who were given remedies such as remdesivir, or what we call remdesivir, in event they were just simply denied treatments which would have kept them out of the hospital in the first place, and treatments which would have saved their lives in the hospital. So we questioned that, and then we questioned the need and, in fact, the safety of the vaccine, and for that we're being disciplined. So legal action will ensue. We have already, in the state of Florida, had a legislative initiative which was signed into law by Governor DeSantis, which, at least in theory, protects doctors like myself from being disciplined or decertified, and that law will go into effect on July 1st. But it remains to be seen what we can do as a state in Florida to address an independent body such as the American Board of Family Medicine. And as we speak, there are folks in Washington, D.C. who are preparing their own investigation of entities such as the American Board of Family Medicine. What does that allow or leave for us to do? The body politic, the average American who knows the need to have freely speaking physicians of conscience, physicians who are independent thinkers still in the medical profession. Well, I think we have to go directly to the offending agent, in this case, in my case, in Dr. Casey's case, the American Board of Family Medicine. I want to let all of you know that I did, in fact, call them about 2 weeks ago to speak to Dr. Warren Newton. Dr. Warren Newton has been there for many years. He, interestingly, graduated in the same year from an Ivy League college. I from Cornell, he from Yale. So we are about the same age, I reckon. And he has been serving in leadership at the University of North Carolina and now at the American Board of Family Medicine for many years. And he's the chairman of the American Board of Family Medicine. And in that capacity, I know he has some say-so, you would think. And if I had time to actually write him the letter that I so desperately wanted to write, but because of my patient obligations and paperwork that goes along with that, and working until 11 o'clock at night, every night, and working on my weekends and on my family vacations, I don't have time to be writing these letters. So I'm just going to tell you right now very briefly what I would write in such a letter and what I wanted to say to him on the phone if they had returned my message. And that's very simply, Dr. Newton, do you really want me, after nearly 34 years, to no longer be able to provide the care that is needed by my patients in the hospital setting? Because that's what happens when you take away my board certification. You cannot practice in the hospital settings. I would essentially have to abandon them to hospitalists who may do a fine job at times, other times, as we saw during COVID, will not. And the patients will, in that scenario, lose their greatest advocate, which is the physician who knows them best, cares for them, and the physician who shares their same values, knows their desires, knows their hearts. So I'm asking each of you to pray that Dr. Newton and the American Board of Family Medicine understand the implications of stripping away my ability to care for my patients in the hospitals. Also, Dr. Newton, do you want me not to be able to teach medical students? I'm on the faculty right now of 6 different medical schools throughout the state of Florida and one that's in Tennessee. And these students who come to me almost across the board they just found it, they're amazed is the right word, I suppose, that there are actually physicians in clinical practice who still go to the hospitals, who are still on call 24/7, who in my case embrace Christian values, and I'm able to implement those values in my practice without really fear of retribution on the part of my patients or my community, but clearly now having to fear retribution from the American Board of Family Medicine, just simply because everything that I try to do as a physician is based on my understanding of what is the most fundamental precept in medicine, which is first, do no harm. And it's with that principle that all my videos and all the summits and all the talks that I've given, really, they flow from that basic precept. In my heart, I have known that much of what happened during COVID was harming our patients, whether it was masking them, isolating them, quarantining them, denying the medications, obviously, and treating them with harmful medications. And then, of course, the vaccine. So you can try to take me to task for that. You can disagree with me as a physician. God knows there's been disagreements in the history of medicine from day one. But that should never be grounds for denying me the right to care for my patients in the hospital, denying me the right to provide a different and a unique perspective to medical students, and denying me the right to even practice medicine should insurance companies mandate that I continue to be board certified if they want to pay me for my services, which would force me to go into a position that I've been resisting forever, which is to become one of those docs who just takes cash only from people who can afford it. No, I don't want to do that. I don't want, at this point in my career, listen, I just got my Medicare card. I mean, I'm the same age as Dr. Newton. I shouldn't have to be fighting these battles to take care of patients. And I'm asking each of you to pray for me. I know 7,000 of you strong on Give, Send, Go have done just that, and others, of course, the Twitter world. And, you know, I never get on Twitter, but I'll be tweeting this out. Thank you for your prayers. Thank you for all the support you can give me. And pray that the American Board of Family Medicine, that Dr. Warren Newton and his colleagues there in Lexington, Kentucky, make the right decision for me and for Dr. Casey Del Coco next Tuesday, June 27th, when they have that meeting of the Professionalism Committee. God bless you. Good night. I really can't thank you enough for everything you all are doing for me. It sustains me.